Hello, I'm Dr. Rostenberg, and I want to personally thank you for checking out my YouTube channel. Now, tonight's video is all about cholesterol. How many of you out there know that cholesterol is an antibiotic? You're going to hear the story of a woman who came to see me in Boise who had a very high cholesterol level and a very bad infection. We treated the infection and her cholesterol dropped very fast, about 100 points in 30 days. It was amazing. Now, to learn how that process works, you're just gonna have to keep watching. Stay tuned at the end of the video, and I will give my recipe for your healing process. Now, I wish we could achieve our results with just diet and lifestyle alone, but supplements really do make the difference. And to help you with that, you'll have an opportunity to order supplements at a discounted rate. We'll see you then. We're going to jump in and talk about cholesterol. It's a very important topic. There's a lot of misconception about what cholesterol is. You're going to see some information tonight that is new research that gives us a new way to look at cholesterol. It's not just this byproduct that floats through your blood and you get a blood test and your doctor goes, too high, or, oh, you're great. There's way more to this cholesterol story than just one blood test. And that's the goal for tonight. So my job in being here is to share with you information that I've been able to mine out. Hundreds and hundreds of hours of work, reading, study, have put this roughly hour and 20-minute presentation together with the high points that you need to know about cholesterol. Cholesterol is critical for health, critical. You'll see that tonight. You'll see that people with high cholesterol are not necessarily bad off, but you'll see people with low cholesterol are definitely bad off. So we're going to flip that whole idea on its head. And it's not just my opinion, it's the PhD published research that we've built this on. So I always like to start big and then go small. That way you don't get lost. So when I work with patients, as many of you know, health can get kind of complex, and it gets complex quick. And if you're the type of person who does research at home, maybe you like to Google stuff online, well, you find out that you learn something and then you get confused, then your confusion grows, and then you kind of just maybe get sick of being confused, and then maybe a little while longer you learn something else, and the process just repeats over and over again. So health is like figuring out a maze. Now, I don't know if the last time you've played with a maze. I have a toddler, so I get to see mazes more often than not. If you start at the end and work backwards, it's really easy. It takes you about 10 seconds to solve the maze. If you start at the beginning and work out, it takes forever, and you got scribbles all over the page. So that's a real good metaphor for how we get healthy. You need the big picture, find out where your target is, and work backwards. So we're going to look at the big picture of our society. All right? So we're ranked last compared to the 11 countries that they compared us to in healthcare. Healthcare in this country is just incredibly expensive. It's inefficient. It's not centered around what patients need or want or care about. It's centered around how much can I do in 2 minutes? How many patients can I see? Hospitals in towns like Boise are making $300 million expansions. $300 million expansions, okay? Where does that money come from? It comes from people like us and our family members who are getting sick and having chronic disease. So I want to make hospitals run a lot leaner and trim the fat so that I want hospitals full of a lot less sick people. And I believe that's totally possible. But we're last in the developed world. We spend the most, we get the least back. It's a problem. And this is not a problem unique to the United States, but we are a very overweight country. And it might also surprise people to know that people who are obese are actually very malnourished. Okay? So there are tendencies. You have genetics that kind of give you your tendency. It's not your destiny, but it's your tendency. Certain people like me, if we get unhealthy, we lose weight. Other people, when they get unhealthy, they gain weight. It's much easier to recognize the person who gains weight, and there's probably numerically more of them. But both people start at a healthy place, and when they get malnourished, the person who tends to lose weight kind of gets more gaunt and loses weight and has trouble keeping weight on, whereas most people typically gain extra weight. And it's just counterintuitive to think about it, but gaining weight and being obese is a state of nutrient deficiency. It takes vitamins and minerals to burn fat. And the heavier you become, the less functional your body, the harder it is to absorb what's on your plate to get it inside of your body. So we're going to look at all these ideas tonight. But a third of the world is overweight or obese. So something's happening, and it's our food, it's the environment, it's the stress, it's everything combining to basically, create this perfect storm. So smoking is going down. Fewer people are smoking now than they ever have. So that campaign has been successful. But due to the obesity concerns, obesity is soon to be the #1 cause of cancer, if it isn't already. Because cancer is caused by, it's generally agreed upon in the research, that cancer is caused by 3 things. Low oxygen, acidic tissues, and low nutrition. So if all 3 ingredients come together inside of someone's body, it's hard for the body to control cancer. Now, everybody you've ever met in your life has cancer cells in their body. It's just something that we have. It's part of normal living. But if our body cannot keep that process balanced, then problems develop over time until, oftentimes I've heard that there's about 1 billion cancer cells before a tumor is detectable. 1 billion, okay? So there's a lot of dysfunction that happens underneath the surface before a problem shows up. And in my office, I like to ask the question, when does disease start? Does disease start when you go to the doctor? Or does it start when you get a blood test and it says you have a diagnosis? Is that when your diabetes started or your autoimmune condition started? Of course not. It starts slowly over time and builds momentum. And every day your body wakes up ready to change, ready to make a difference. But if we don't change what's going on inside the body, then the body will just keep going in that snowball effect. So obesity, it's a big problem. It has effects on our brain. So unfortunately, I watched a little bit of the Oscars for a brief moment, and everybody was talking about Alzheimer's and how important that is to raise awareness. I could not agree more. Could not agree more. And you'll see a chart here that I've shown before that's it's staggering how big the Alzheimer's and dementia trend is. It's like, it's out of control. And what goes on inside of our body in terms of our hormones, especially fat around the middle of our body. Fat packed around the middle is what we would consider the apple shape. And that's due to 2 hormones mainly. What we would call the beer belly is cortisol. So it's really the cortisol belly. Okay? So when you see a guy with a large beer belly, as it's called, you're looking at someone who's been under the influence of too much cortisol for a long period of time. We'll get into some of that tonight. But the love handles, they're actually insulin handles. Okay? So if you look at people's blood tests who have a lot of extra fat right here, their insulin is higher than their other hormones. So scientists and researchers have figured this out. We store fat based on which hormones are out of balance and where. But it shrinks our brain. That's the moral of the story. The bigger our waist gets, the smaller our amygdala and other parts of our brain get that control our memories. So this is our long-term memory. So the same biochemical consequences that make belts feel tight and pants feel tight is making your brain shrink. So it's like a teeter-totter. This is, I'm not picking on this family, but this was a photojournalism study that was done, I think it was a couple of years ago. They asked families all over the world to just, hey, look, collect what you buy at the store. What do you eat in a week? Put it in front of this camera. We'll take a picture. Everybody smile. We'll publish it. We'll write an article about it. It's a really good article. I forget which magazine it's from. But there's nothing on that table that would qualify as nutritionally adequate or healthy. And probably most things, you could leave the house for vacation and come back in 6 months, and most of that stuff you could just open and eat. So that doesn't really meet the definition of food. So this is why. This is the big why behind the mess that's out there in the world, especially in our country with people's health just not working. We're not born with defective bodies, okay? The body's perfect. It's really, really smart. It knows exactly what to do at every moment. But being perfect is not the same thing as being invincible, okay? You can't just turn it into a garbage receptacle and expect it to work. So GMOs, Yeah, we don't like them, right? GMOs are a big problem. That's why we shop at stores like this and other places, and we buy local food, we buy organic food, and we vote with our dollar. But GMOs, this is a picture about when GMOs were introduced to Britain. So this is what people have to wear to inspect the crop, okay? That's not normal. That's not what farmers typically wear, right? So in the United States, when they study GMOs, they do 9-week studies. So they give lab animals genetically modified corn and soybeans and other foods for 9 weeks. Then they sacrifice the animal, they investigate what's going on, is there disease, what's happening to this living creature. And they say, oh, look, nothing's wrong, everything's normal. In France, they did a study for 9 months. And what you see on the screen is what happened after 9 months of eating GMO food, okay? So, 50% of men in America will get cancer. 33% of women will. That was 5 or 6 years ago. I don't know what the rates are now. So, clearly what we're eating and what's in our food supplies is impacting this, and we need to make it go. We need to change course. This is some new data I found. This is a researcher, the woman on bottom, she's a PhD researcher at MIT, Massachusetts Institute of Technology. We've all heard of this school. It's very prestigious. She's a genius, okay? She's using a computer to look at data differently. She's analyzing data from a different point of view, and she's coming up with all these connections that previously we couldn't see. So what the red line is the rate of autism. That's what the red line is on the screen. The bars underneath it are the amount of glyphosate, Roundup, being used to grow crops. So that doesn't mean causation, but that is beautiful correlation. And when you get into the studies of what glyphosate does and Roundup, it poisons your gut. So it's true that we don't have the same chemistry that plants do, and so technically speaking, Roundup doesn't poison the human body. Okay, I would agree with that, that's fair. But we depend on bacteria in our gut for survival. And the bacteria in our gut are poisoned just like plants are. They have the exact same biochemical pathway. So we're finding that people's digestive systems are just getting destroyed and torn apart. And so they can no longer feed the individual, and then they develop all these chronic health problems because of that. So she thinks by 2025 that half of every kid will have autism. That's what the computer projects if trends don't change. How are they going to explain that one away? They've always been here. We just didn't know how to diagnose them. It's just it's not normal. So this is it's coming to a head. The issues that we focus on and study in natural medicine and being healthy. There's more awareness. It's coming to a head. I'm not trying to use too much fear here, but it's just interesting the data that's coming out. I mentioned Alzheimer's, and we'll relate this back to cholesterol here in just a minute, but if you happen to live to the age of 85, right now you have a 50% chance of dementia. Now, I'll admit that probably our octogenarians and the centenarians are not the people, they don't have the most energy and maybe they don't have the sharpest mind, but there's a lot of people that age who are very, very sharp, and I don't think historically, this is a break from a historical trend. It wasn't a guarantee that you would have dementia just because you lived into your 80s. But for half the people that do, it is. So what's changed? What has changed in our society? We've changed our food, we've changed our blood sugar, and we've changed how we look at fats. So this is a chart from the CDC. I made some notes, the little rectangular pieces of information there, the Stop Smoking campaign. So you can see that about the late 60s, the smoking campaign got into full gear. And you can see that the blue line at the top and the black line come down a little bit. That's heart disease and stroke. So of course, when you stop smoking, you prevent some stroke and you prevent heart disease. And that's what those two lines going down shows. The line in between, the blue line, malignant neoplasms. That's medical speak for cancer. Okay? So cancer hasn't changed. The line is still horizontal despite all of the fundraising, all of the treatment centers. Okay, it's prevention that's going to fix that problem, right? But the line at the bottom, I've dashed red, that's Alzheimer's. You can see before 1980, it didn't exist on the chart. And I should point out this chart is the top these are like non-infectious causes of death. So this is the top six or so causes of death in the United States based on 2010 data. Alzheimer's was off the chart low, did not exist in 1980, and now today it's the 6th leading cause of death. It came out of nowhere. Now did we all of a sudden learn how to diagnose it? Because we were putting people on the moon in 1970. I think we were smart enough to recognize Alzheimer's. Well, what's changed is that bad advice, really, really, really bad ideas. Whole grains till the cows come home. Eat whole grains for breakfast. Your cholesterol will thank you. Your heart will thank you. Take statin drugs to lower your cholesterol even more. Eat low fat because, eggs and grass-fed beef are just, basically they're going to mug you in the middle of the night and hurt you, right? That's kind of the logic behind this insanity. Now, people who grow cereal and sell cereal, well, that's a great idea. Let's spread that idea around, and I can sell more of my rice and my wheat rather than you eat this other food like avocados and eggs and everything like that. So that's the change in trend, in my opinion. It's our misleading and our inability to understand how important fats are for the brain. When you starve the brain of fats, you lose your mind. So is cholesterol good or bad? That's the question we're here to answer tonight. And I could stop the presentation right here and just show you this slide. I could do it, and I would make my point. U.S. Department of Agriculture, USDA, said that they're no longer advising anyone to have any restriction on dietary cholesterol. They've taken away the limit that they believe is, they used to say below like 300 milligrams of cholesterol a day. But the new science, they basically admitted that it doesn't matter what you eat. What you eat has no influence on your cholesterol level, at least a negligible amount. That's from the USDA. So if it's coming from them, you know that there's a mountain of data to back it up, because they would do this very reluctantly, right? This came out like 2 days ago. So I'll finish the presentation though, because I think there's some good stuff. But there it is. They've said it. And that's what we're going to show how that works and how important cholesterol is. It's fascinating stuff, you guys. More data. Now I have a 80-20 split, maybe 90-10, but about 10% of your diet can influence cholesterol. But you have to remember too, when you eat something, you chew it and you swallow it, and it literally has to go through about 20 feet of tube before it becomes like a muscle or part of your eye. Right? So just swallowing something is the first part of this huge process that has to nourish you. So what you eat can cause leaky gut, can inflame you, can cause bloating and gas and constipation. Those things could raise cholesterol. Okay, I'll show you how that works, because cholesterol is an antibiotic, guys. You'll find that out tonight. Cholesterol is one of your body's best antibiotics, and the science is rock solid. It's really cool stuff. But this is just data that shows, hey, what you eat really does not influence cholesterol levels, and I would agree. The liver is responding to other signals whether it makes it or not. Now, if you're someone who's a junk food addict and eating 5 sodas a day and dumping a bunch of high fructose corn syrup down your mouth, you will raise your cholesterol levels because your body converts blood sugar into blood fat, and then eventually, and into body fat. So you can definitely pull some levers and pump out some more cholesterol. But for most of us who are eating if you're eating like a paleo-style diet or just a healthy vegetarian diet, etc., your diet has very little effect on your cholesterol levels. This is a study that comes from the American Heart Journal. This is a major medical publication. And they looked at about 137,000 people. That's a huge number. And they wanted to ask the question, what's the relationship between coronary artery disease, clogging my arteries, and cholesterol levels? And basically, there is no correlation for LDL levels. There's no correlation. Look at the chart. Look at those red bars, okay? Draw a line where the bars are at their peak. That's an LDL of about 100. That's where the lab says it's anything above that, the lab would say, your cholesterol's too high. So right in the middle of that spread of data is too high. Half the people who had coronary artery disease had high LDL, That fits their model. Yet half the people had low LDL. That doesn't fit their model. So what's wrong with their model? Well, it has nothing to do with cholesterol. It has to do with inflammation. And that's the driving force behind damaging your arteries. When you have a plaque in your arteries or you have some kind of coronary problem, it's like having a scab on your elbow because you fell down and scraped your elbow. That's all cholesterol is. It's just like a scab. So you don't blame the scab for falling down and hurting yourself. You want to stop the injury, and the injury is from an inflammatory process. But I should say, too, the HDL is protective, and you'll see that over and over tonight. HDL is really protective, and this data proved it, too. If you had an HDL over 60, only 10% of people who had coronary artery disease had an HDL over 60. So if you hit 60 or above, you prevented 90% of coronary artery disease, just by that one measure alone. Okay? It's all about total cholesterol to HDL. So again, in my office for men, we like to see the total cholesterol HDL ratio below 4.0 for sure, because you don't want to be average risk. You don't want to be average risk, because average in America is horrible. Okay? If everybody's living on minimum wage, you don't want an average salary. You want to do better than that. And same is true with your cholesterol. So you want to have a very, high HDL cholesterol ratio is very protective. Very protective. So that's the number to look at, and I'm simplifying things tonight, but that's really the main number that you want to see. Okay? So I'm picking on, popular medications. Again, it's not my opinion, published research. I have this idea that people aren't sick because they were born without medications in their body. They're sick because of all these other factors: diet, stress, toxins, malnutrition, poor sleep, etc. But they looked at statins. This is from the Archives of Internal Medicine, another major journal, and they could not find evidence that statins prevent cardiovascular problems in the individual who's never had a heart problem, any bypass or any heart attack. In that individual, which is most people, statins don't prevent anything. And then they also raised questions about what's the role of the pharmaceutical company in sponsoring the studies that proved that it did. And it's the same old story, same old song and dance. If we can make $10 billion, we'll cheat, steal, and rob our way to do it. And if we poison a few people along the way, it's okay. It increases diabetes. So statins in females, they were looking at postmenopausal women, I believe, in this study, 153,000. Again, big number. It increased diabetes by 71%. So if you start to mess with cholesterol synthesis, which is what statins do, you also deplete your body of CoQ10. CoQ10 is called ubiquinol because it's ubiquitous. It's everywhere in every cell. It helps you burn energy. It helps your mitochondria produce, its furnace that gives you all that great energy and focus and excitement about life. So when people take statins, their levels of CoQ10 decrease. And in some of those side effects from statins that cause like muscle pain, they call it rhabdomyolysis, muscle pain and these other side effects, they've shown that they can be prevented by taking CoQ10. So certainly the research would suggest that anyone taking statins needs to be taking CoQ10 to at least protect CYA, all right, to cover that base. So, basically, when they gave statins, this is from 2013, when statins were given to patients, significantly reduced their CoQ10. So there's that relationship. So CoQ10, you need it, it's essential, and statin drugs interfere with that biochemistry. I'm going to pick on beta blockers as well. Again, I'm just reading the medical research. It's out there, it's published. Journal of American Medical Association, very prestigious journal. They looked at 45,000 people on beta blockers. It didn't help prevent stroke, heart attack, or the risk of heart attack.
I've heard that if you have a heart attack while on a beta blocker, it's more likely to be fatal. CPR is less likely
That's an interesting comment. So the comment was individuals who are on beta blockers, when they have a myocardial infarction, a heart attack, it's harder to resuscitate them because beta blockers block adrenaline, and your body uses adrenaline to save your life in periods of fight or flight or stress when your life is threatened. So, you know, they're trying to chemically, like, put their boot on the body's neck and kind of hold it down rather than figure out why there's too much adrenaline or where the inflammation is coming from. And look, I'm not saying we, you know, throw all the medicine away. Clearly there's a role in some extreme situations, but that's not the way it's practiced. And that's what the awareness about nutrition and health is all about, is, you know, empowering you to figure this stuff out on your own so you can be your own doctor. We're going to hold questions here till the end, if you don't mind. So here's a quick video about a patient who went through our process in our office. And all right, we're here today with Vicki, who's been a patient of ours for several months now. She's made quite a transformation. And Vicki, would you mind telling the viewers what you were going through when you first came in?
Well, when I first met with Dr. Rostenberg, I was kind of going through some depression and some weight gain issues and self-esteem issues and having trouble sleeping at night and a lot of allergy issues. And since I've been seeing Dr. Rostenberg, I feel wonderful. I've lost, gosh, almost 40 pounds now, and I don't have trouble sleeping at night, and just, you know, making healthy choices in what I eat, and I found that I don't have to starve myself, and I actually get to eat 6 times a day and quite a few calories. It's just making better choices in the food that I take in, and it's helped in all areas of my life. I just have more energy and sleep better, and I'm happier, and my health is improving with my blood pressure and my cholesterol, and I've tried all kinds of other things in the past and none of them have worked, and this is the only thing that seems to work. It's just, you know, going through that detox and resetting my metabolism really made a difference.
You know, as a doctor, we like to think that we do the best job of explaining everything, but oftentimes patients do a better job. They make it more down to earth, and just telling someone what you've been through is a good way to communicate, you know, the ideas behind what's gone on. So, you know, when you're treating cholesterol, I don't even like that phrase. When you're treating people and helping them get healthy, all kinds of things start to get into balance. So I've talked about, you know, sleep before. If you don't sleep, that's kind of the biggest hole in the equation that has to get worked on first, because sleep is when your gut restores itself. Like, we're standing here right now listening to me, trying to focus. I'm here communicating to you. Neither one of our digestive systems is actually repairing. It's sort of like maintaining, and when you sleep, that's when all the big work and heavy lifting is done. So people who don't sleep well don't digest well. They can't lose weight well. They're overstressed out. I mean, just look at kids. We're all just grown-up toddlers. I have a 3.5-year-old. You know, missing naps and not sleeping is a recipe for disaster. It's just easier to see in a toddler because it's like right out, the correlation is really tight. We have this, you know, sometimes we can go without sleep for a while and kind of push through it, but we forget that pushing through it means you're sort of doing this over time, and then you do this a little more, and then you wake up down here going, oh man, what happened? Well, a lot of things happened a little bit, and they accumulate, and now you need to come up with a strategy to kind of, you dug a hole, so the fastest way to get out is just climb a ladder and get out. Digging your way out will, again, just take a lot longer. So that's the critical concept, is that, you know, treating cholesterol and managing numbers without understanding what it really means, what cholesterol really does, is not going to prevent people from having heart problems, which is what the research says. It doesn't matter if you have low LDL or high LDL. The risk of coronary artery disease is pretty equivalent in this study that we showed. So the idea is treating inflammation. That's the big, giant problem. And we're a very inflamed group of people. Anybody who has an itis in their life, arthritis, you know, tonsillitis, tendinitis, you know, autoimmune disease, pain. We all experience pain. Pain is inflammation. Some people experience a lot of pain. Some people have really, really bad low back pain. I mean, they can barely walk. You take an x-ray, and their back looks fine. There's literally nothing wrong. Joint spaces are good. There's no degeneration. Well, what's that all about? Other people you do x-rays on, and they have the most, their back, they're 35 years old, but it looks like an 80-year-old spine. It's degenerated, and there's a lot of arthritis, but they have no pain at all. So pain comes in different forms and shapes. You can't just say everybody who has a joint problem has pain, and everybody with pain has a joint problem. So pain is a neurological phenomenon. If you cut the pain nerve from your finger, you can't feel your finger hurting anymore. So pain happens in the brain. And it's a chemical messenger system that brings it up to your brain and makes you aware of it. But pain comes from inflammation. It's just that simple. People you know in your life who hurt a lot have a lot of inflammation. And there's quite a bit you can do to improve that naturally. This is a new slide I put together. You've heard about people having 99% blockage of an artery. Who here has heard that before? I'm like, 99%, oh my gosh, how are they still alive, right? That's almost practically zero left. The tube is so tight. Well, what happens is the injury and the atherosclerosis and the cardiovascular disease doesn't begin when they walk to the doctor and find out that they have it. It's been going on a long time, a little bit at a time, so it's built up. So very slowly those pipes start out nice and big and clean, and then the plaquing starts, and they slowly creep together, right? And they creep together slow enough so that your body can grow branches around it. Your body's really smart. It's not going to just let that tube shut off. It's going to go, well, there's a problem with blood flow, so let's sprout some new vessels and kind of work our way around it. So if the blockage has collateral circulation, then what does it do to treat the blockage with a stent or to roto-rooter out the clot? Maybe you create a stroke because you create a bunch of chunks of plaque that are now floating in the bloodstream and going further up. I'm just asking, just to provoke the thought. That's happened before. So I don't have the studies to show you tonight, but I know that the idea that stents prevent cardiovascular disease as well are also being called into question because it's not treating the cause of inflammation that's causing the whole problem. So this slide just shows you that they put a stent on that picture, the C. Imagine going to the doctor and they find the C condition, like, oh my gosh, 100% blockage, we're going in, we're cutting you open, boom, 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 boom. Well, you just went through surgery, and that was expensive and painful, and it's going to change your life a little bit, but it's not, the body's already compensated for that. There's no way you can be alive with 99% blockage. Your body's already collateralized it. Does that make, so your body's great, has all these resources to do this stuff. So what we want to do is prevent that in the first place, and that's what getting healthy is all about. So the real danger is inflammation. Who here's heard of homocysteine before? Has anybody heard of that? Homocysteine is an interesting molecule. It relates to your genetic pathways. It relates to your B vitamin pathways. It's produced in all of your cells. And homocysteine is this marker, this great indicator of how inflamed someone is. Okay? So in our office, the numbers we like to see are between 4 and 8. 4 and 8. It's true, we're picky. I'm very picky about that. But that's where optimum is. Above that, there's more inflammation. There's a lack of B vitamins. Okay? They're not getting enough nourishment from like green leafy plants. They're missing out on nutrients, and that nutritional deficiency is creating more inflammation because your body uses vitamins like fire extinguishers. Not enough vitamins, too much inflammation. That's how we get skewed. But again, inflammation increases the risk of having a problem with the heart. And there's thousands of studies that show this. These are just a sampling. Inflammation raises blood pressure. Okay? Inflammation makes your blood thicker, more viscosity. And the thicker the blood is, the harder it is to push it into small blood vessels, like on the tips of your finger. Which is why when you go to doctors, and we do this in our office all the time, we put pulse oximeters on people's hands. I want to see if they're actually getting oxygen into their finger. I'm not really concerned that the cuticle and the fingernail is getting enough oxygen. I'm concerned if the brain is. But because the brain and the finger both have small blood vessels, you can see the deduction from that, right? So if you can't get blood into your fingers, you can't get blood into your small parts of your brain, or perfused into these deep recesses of your body. So inflammation makes your blood thicker. Estrogen thickens the blood. So women go on birth control. I have patients in my practice this has happened to, and they have a stroke 30 days or so later. Okay, so what happened? They took birth control and their levels of estrogen just went way up, and it used up all the vitamins that were around to try to detox the estrogen, but then there's no vitamins left, no B vitamins to do that. And so then the estrogen keeps building, and estrogen makes blood clot and get thicker, stroke. It's a side effect of a lot of birth control that young women are taking. I think the NuvaRing is maybe one of the more common or more common ones used today, and there's a lot of young women who are having pulmonary embolisms and really getting crippled from this medication because it's clotting the blood. So inflammation clots the blood. So people who have a tendency or family history of strokes or deep vein thrombosis or pulmonary embolisms, you're looking at the blood in general terms just way too inflamed. It's not, the body doesn't have the resources to get the viscosity of the blood to a correct level, and you have to just trust that the body knows how to do that if it had the resources. So you can use, in some cases we've used high doses of fish oil that has a very thinning effect on the blood. But again, nutritional interventions tend to create a benefit without a risk. There's yet to be a study that shows that high-dose fish oil causes a bleeding disorder. Show that to me. I'd love to see it. It doesn't. It just thins your blood to a point and then it stops. And your body uses the fish oil for other stuff. That's the beauty of natural things. They work really well with fewer side effects. Inflammation also causes the blood vessel to get tight and seal shut. So again, you have the same problem of getting blood to your brain, getting blood to your organs, getting blood to your fingers and your toes, the tip of your nose. Inflammation devours or consumes and removes what's called nitric oxide. Now that may not be a term everybody here is familiar with, but everybody here is familiar with the word Viagra. And Viagra is only a medication because of the science that proved that nitric oxide makes blood vessels open up. So arginine is one tool we use to increase nitric oxide. So people who have peripheral artery disease, okay? People with cardiovascular atherosclerosis in the carotid system or other parts of their limbs and in their body, nitric oxide becomes really important because it keeps their blood vessels open and it stabilizes the plaque. It prevents the plaque from rupturing, which is when big events happen. And again, where does arginine come from? It comes from beets. It comes from good protein sources. People don't digest well. They become arginine deficient pretty quickly. So there's lots of different tools that are available in the food supply to help with this. But ultimately now we're talking about cholesterol. So I want to get back to that. All those slides I showed you about heart disease and stroke, cholesterol is a player in that. That's why they would always look at the person who had the stroke and they'd find a ball of cholesterol wedged into a blood vessel, blocking everything above it and creating a blockage from everything coming up. So they'd say, man, that cholesterol is just getting in the way. It's a cholesterol problem. It's a cholesterol problem. They'd look at an injury to the inside of the blood vessel, and all it is, well, there's calcium and other, white blood cells, foam cells in there, but it's mainly cholesterol. And they'd say, look, cholesterol's a problem. We got to get rid of this. We got to lower it. But they're missing the mechanism that's causing cholesterol to go there. We have to just realize that your body's not going to create a plaque or it's not going to create a clot for no reason. It's going to do everything it can to prevent that. But stress consumes cholesterol. And stress is, you could make the argument that it's the biggest problem we face. You can't hardly turn on the TV without being shown something disturbing. They're chopping up dead bodies at dinner time on TV shows that people watch, and the news isn't any better. And that's just on television. That's supposed to be entertainment, not to mention the financial stress we all face and the busyness of our world. So the moral of the story is that life is really stressful today, probably more than it's ever been in human history. I think they actually figured out that serfs in medieval Europe had more time off than we do. I would like to go fishing more and take more walks in the forest, but we're here. We're gonna make it work. But stress consumes cholesterol because cholesterol makes cortisol. Cholesterol is like this amazing building block that makes cholesterol, makes testosterone. It's the precursor. It's the foundation for progesterone, aldosterone, all these hormones, all these steroids. So you hear about people taking prednisone, yeah, or cortisone shots. Well, they're just taking synthetic cortisol that's made by the body from cholesterol. So what benefit do we have to lower our cholesterol if we need it for at least, that's just part of it, but we need it for all those hormones. 80% of your brain is made out of fat. 25% of your cholesterol is inside your skull. It's in your brain. So if you start to lower cholesterol in your body, you start to drain out the raw material that your brain's made out of. Not a good situation. This is the chart that shows the cholesterol kind of cascade turning into all these important hormones. And where I drew the purple arrows, that's what goes really, really fast. So when people are in, this is adrenal fatigue in a graphical form. So if you've talked about adrenal fatigue, you've heard about it, this is what it looks like in a two-dimensional graph. Over here on the left in the purple area, you start to get, you're aware of the stressor and your body begins to mobilize resources to confront this problem, whether it's, a court date or buying a home or moving across the country or starting a business, whatever. You can name it, your body, there's a million different things that could cause this. And so your body pushes resources towards stress hormones at the expense of sex hormones. So this is where women become estrogen dominant really easy because all of your cholesterol is getting pushed towards making stress hormones. There's not much left to make progesterone. Then women start to have cycles where they don't even ovulate because they're so stressed out. And when you don't ovulate, you don't get progesterone. So it's like that's the root cause of that phenomenon, It's just the effects of stress on the body. And men are in the same boat. Testosterone levels are probably, they're low in general across the board. I don't know if the average has gone down, but I know the average sperm rate has gone down 50% in the last 40 years. That would be, to me, a reflection of health in that part of our body. So men are not immune either. But your body initially rallies, and then it fatigues out. So the more cholesterol you have in reserve, the longer you can maintain the fight. Does that make sense? So if you run out of cholesterol, you can't make cortisol. If you can't make cortisol, you can't live, actually. People who have adrenal failure pass away. They literally can't. So adrenal fatigue is not just a diagnosis that, we talk about a lot. It's actually a serious condition in its final stages. It can literally end someone's life because without cortisol, you cannot live. It's just that important. So the idea here is two things. We're going to get into the nitty-gritty here with more cholesterol in just a second, but there's two things that help you age well. Muscle mass is the first. When you go into the hospital, heaven forbid, you have a surgery, you have a life-threatening event, and you have to be in the hospital for a month, you will eat your own muscles. Because your muscles are full of vitamins, protein, minerals, and fuel for every other system in your body. And when you're in the hospital fighting for your life, you don't need to be able to bench 200 or run far or hike a long time. So your body will correctly pull that stuff out of savings. So my encouragement to you is not to try to look, like a bodybuilder, but make sure that you're doing something that is some resistance work. We all need to be strong. You don't have to be huge. You just have to have a good ratio of muscle mass on your frame. It's the number one predictor of aging. The number one. The other one I'm going to recommend is that you make sure your cholesterol is above 165, total cholesterol. And you'll see that below 150, things start getting pretty hairy. I'm going to show you one more video of a patient who just came in with some adrenal issues that relates to this. Okay, we're here with Jo Lynn, who has been doing some work with us in our office for some challenging symptoms she was experiencing. And Jo Lynn, would you just share with us briefly what was going on with you when you first came in?
I was experiencing cortisol deficiency, adrenal fatigue, high blood pressure of unknown origin, muscle and joint pain, extreme fatigue, and had been diagnosed with a genetic defect with my adrenal glands and had just come off major surgery, lost half of my left kidney, and had a septic episode that almost took me in the ICU a year prior to this. So did some genetic testing and found out that I had the MTHFR reductase deficiency, homozygous, meaning that I had the worst ability to methylate. And without methyl donors, the things that I went through the last couple of years was not going to get better. So started taking methyl donors, started taking antivirals, antibacterials that are natural, and some immune support supplements, and within the last 4 weeks I've come from 70 milligrams of steroid support to between 10 and 12. That keeps my muscle and joint pain in check. The fatigue is just about gone. I'm able to exercise now. I'm doing some interval training and a little bit of weightlifting, which I've not been able to do any of that. My blood pressure is normal. I was on Norvasc and Micardis at 80 milligrams a day, and I'm off both of them. Not only is my blood pressure down, but it's 116/75, which is the best blood pressure you can have, and that's absolutely amazing. And I'm on a ketogenic diet that Dr. Rostenberg put me on, and my digestion's better, and my energy's better, and
Sure.
everything.
So given the progress you've made in working with us, would you recommend what we do here to others?
Absolutely. I would have to admit I was a little, didn't know if I believed in kinesiology, I guess, but I have to say that after 3 years with traditional medicine and 4 weeks, I feel like I'm myself again. You need to give it a try.
So again, sometimes patients do a better job of explaining things than doctors, but she had been in a situation where diagnoses were thrown at her and it was very confusing, and she had almost died from sepsis. Okay, so if you have a sepsis episode, right, and you have a kidney infection, that bacteria comes from your gut. So that's gut bacteria washing into your body, getting stuck in the kidney as your kidney filters, boom, infection, okay? And when you survive sepsis and you walk out of the hospital, you're just like 2 notches away from where you just were. You're not back healthy again. And what we were able to figure out was, she's a smart individual and actually is a health coach and dietitian herself. You have to work on killing the microbes that are still, her body's struggling to get rid of these bacterial infections. And so we used a combination of herbs and essential oils and things, and that's what was making the difference for her. Everybody's a little different. That may not be everybody's concern, but she was able to reduce her adrenal fatigue by treating an infection. So adrenal fatigue, a serious type where she was taking synthetic cortisol, was alleviated by using something that killed bacteria. What's the connection between bacteria and infection and adrenal fatigue? Well, your body knows if you have an infection, whether you're aware of it or not. And I would wager to bet that you're not aware of it till your fever's 104 or you're vomiting and you're uncomfortable. That's when you know, oh, I'm sick now. Well, your body knew it the second that bacteria got into your body. It's going to do everything it can to treat it without ever having you know anything about it. That's kind of cool. But it stresses out your adrenal glands profoundly, and your body runs out of cholesterol. So I'm going to run through a few ideas behind cholesterol. So low cholesterol is associated with some infertility issues because the hormones that make us fertile come from cholesterol. And they were showing some changes in sperm shape and quality based on cholesterol not being, sperm cholesterol levels in unexplained infertile patients were significantly lower. So basically, men who have low cholesterol don't have enough of this healthy fat to produce good sperm, and therefore infertility rates go up. Now, the brain needs cholesterol. When we lower cholesterol, we increase the risk of dementia, as you'll see. but we also increase the risk of depression. Cholesterol low, odds of having neurological brain problems go up, okay? There's no benefit to low cholesterol. There's no benefit. It's more of a danger, in my opinion, than having a little bit elevated cholesterol. Well, not the funnest subject to talk about, but people who take their own life or attempt it have low cholesterol. It makes you depressed. Your brain doesn't work right. You make bad decisions. Same with this one. Hannibal Lecter is a creepy guy, okay? People who do that type of crazy stuff in this world, they've looked at the cholesterol levels of violent criminals. It's lower than average. You bet. Not good brain health, bad decision making. I do whatever the voices inside my head tell me to. I mean, I don't know what the real pathology is there, but not having good cholesterol levels puts you at risk for not feeling like yourself. You don't feel good. You're going to feel depressed. You're not going to have the hormones you want. Memory loss. It's in the brain. If you're not feeding the brain, you're not going to, don't expect to be sharp that day. So, autism. They looked at autistic kids, and you know, many of them have had cholesterol at the lowest quintile. So, you know, they divided into fifths, all the kids in this group. All the cholesterol levels, they divided equally into 20% groups. Most of the kids who are autistic were in the lowest 20% group. So again, brain problem, cholesterol. Feed your brain by making sure your cholesterol levels are in a healthy range. It will make a difference. It prevents dementia. I work with people on their genetic concerns too. There's a lot of people doing genetic testing. They're finding out what their parents had, they're finding out what genes they have. And the APOE4 gene is the dreaded Alzheimer's gene, but that's an incorrect way to talk about it. Okay? It's incorrect. But it's out there on the internet, so you'll see it. Despite that gene, doesn't matter if you have that gene, doesn't matter what age you are, what sex you are, what your cultural background is, what economic level you're at, if you have low HDL, your risk of dementia goes way up. If you have high HDL, it's protecting you. So it's all about healthy fats. So in this study, they're saying above 55, 60. 60 is a good number. 50 in men for sure, 60 in women. Yes, 50 in men, 60 in women are the numbers you want, the targets that you want to hit. So I talked about infection. It's just so fascinating to me. That's something that is demonized. And you know, it's so fascinating to me how bad ideas spread. So cholesterol was demonized as a bad thing, and I showed you the chart in the 1980s. They said, go low cholesterol, eat your Cheerios, eat your Wheaties, eat whole grains, eat as much as you can protect yourself, and life is great. Well, you saw what happened to Alzheimer's disease when that advice was followed through on, okay? Now this is kind of cool because this shows that LDL and HDL protect you against sepsis. They protect you against infection because dead bacteria stick to it like flypaper, okay? So you don't want dead bacteria floating through your bloodstream and going into your kidney and getting up into your brain. You want your cholesterol to kind of glue together with that stuff, and then your body can get rid of cholesterol, and it can get rid of the dead bacteria. See how that would kind of clean your blood up? So cholesterol is like this sponge in your blood, and it grabs onto the remnants of bacteria, combines with it really tightly, goes into the gallbladder, and it's out for good. And that protects you. So people who have high cholesterol, I mean like 350, probably have some kind of infection. You have to rule that out because, again, the infection is raising cholesterol because your body's using it like an antibiotic to get rid of the bacteria. And we've seen this over and over again in my practice. People with really high cholesterol, we give them support for their immune system. We help clean their gut from bad bacteria, aggressive bacteria, and their cholesterol just goes right back into range. So when I see high cholesterol on a blood test, like over 260, I've seen 375. They're like, everybody in my family has high cholesterol. Well, it's not as common as you think that this idea that everybody has high cholesterol in my family. It's not that common. It means that people in similar houses have similar diets and similar stress, and they're exposed to similar bugs. MRSA is like this, terrifying bacteria that's completely antibiotic resistant, or certainly getting to that point. But LDL, the bad cholesterol, binds to MRSA and activates it. Okay? Again, cholesterol is an antibiotic. in your body when you have an infection, okay? So gallbladder health, I have that circled over there. So I mentioned that once the cholesterol and the bacteria glue together, it has to get out of your body. Now we all know somebody who's had their gallbladder taken out, and there may be someone in this room who's had that problem. So gallbladder health is another area that we need to make sure is working as well, because it's the route of elimination of fatty toxins. Cholesterol bound with garbage like this, your hormones, heavy metals, go out through the bile. And bile helps you absorb the stuff you need, vitamin D, vitamin A, vitamin E, fish oils, all this healthy fats. So you see that we have all these people with gallbladder disease, and gallbladder disease kind of acts like a big biochemical bottleneck, like there's a cork in the wine bottle. You can't get this stuff out of your body. Well, there's another flip side to the story. You also can't get stuff in. Stuff is stuck on the inside that you're trying to get rid of, and you're trying to absorb stuff from your plate and your diet and your supplements, and it's having a hard time getting in. We see this all the time. People take 5,000 IUs of vitamin D, and their vitamin D level is in the teens. How's that possible? Well, they're just not absorbing it. So making sure your gallbladder works, even if the gallbladder's been removed, there's a lot you can do to promote good gallbladder health. It works. You just have to remember that you need to create a saponification of fat. You have to take big blobs of fat and cut them into tiny blobs, tiny little balls, and then you can absorb them. And that's what bile does. It acts like soap. It's like Dawn dish soap that your body makes. And Dawn soap, when you're cleaning your dishes, makes that fat on that olive oil on your plate just turn into little bitty pieces. That's exactly what bile does. So this is just more data that says, this is now talking about HDL. HDL is just so protective as well. It protects you from infection. So I'll see someone with an HDL of 110, almost double the good level, almost double where you want it. That person, they have an infection from their gut or some hidden infection in their body is really the likely reason why that's happening. And it's an intelligent response. Your body's making more of this antibiotic to help deal with the infection. So again, anti-inflammatory. Cholesterol protects against inflammation, protects against infection. Most people are overly inflamed. Inflammation damages blood vessels. Inflammation is what's behind heart disease. Inflammation is why people have high cholesterol, because your body's using it to protect itself from the damage of inflammation. That's the big picture. So cholesterol is not the problem. It's not the problem. The inflammation is. Again, just more new stuff I was looking at even from last year. This was interesting to me. People who are fighting for their life with sepsis are now getting injected with HDL, and it's improving them. Okay? Not only because of the mechanism I just showed you, that HDL is like a sponge and it grabs onto dead bacteria and removes it. Because if the dead bacteria doesn't get removed from your bloodstream, it will trigger a great deal of inflammation. Obviously, your body's listening to see if any attackers are out there, and if broken pieces of bacteria flow by and connect to the outside of a cell, it sets off a cascade of inflammation. So if HDL can intercept that and glue to it and then leave your body, you get rid of the infection and you don't get the inflammation and the damage that would come from that. It's really, really smart. The body's perfect. Perfect but not invincible. But they're injecting HDL into people, and one of the reasons they think it's helping them when they have sepsis, which means they have an infection, they're fighting for their life, they're in the ICU, is that it helps them make more cortisol. Okay? Cortisol saves you when your life is threatened. And this includes being in the hospital bed with an infection. So, it just sort of like all fits together. There's a reason why we have cortisol. The problem we have as a collective is that we use our stress system all the time. So I'm really adamant about protecting yourself from stress. I mean, it doesn't mean you won't take on challenging tasks and you won't deal with people in your life who make you stressed out, but you guys got to follow the platinum rule. And the platinum rule is, we all know what the golden rule is, treat others the way you would like to be treated. That's true. But what if they don't treat you back the same way? Yeah. So maybe the platinum rule makes sense too. That is, treat yourself the way you want others to treat you. So don't willingly put yourself in places where, you know, people are going to poop on you, okay? To use a very simple idea. So don't let other people poop on you, and you'll be a lot less stressed out. Because in the animal kingdom, that's how it works. The top dog poops on the one under him, and then on down it goes. And they've studied this in animals, and they just find the people at the bottom, the animals at the bottom have their adrenal glands are a mess. So, you know, just enforce your boundaries and be selfish sometimes, and it'll be, you know, it's an interesting exercise, because we're like trained not to do that. So everybody poops. Yeah, I'm going to talk about that. It's a story every toddler gets to know. We've all heard it. But I have a picture of a climbing event, because that's what I like to do in my spare time, which is very limited these days. But this is in the Sawtooth Mountains. This is Elephant's Perch out in across from Redfish Lake. And this climb is about 1,000 feet tall. We're just getting started, so we go up about 1,000 feet. Moral of the story is, even when you're climbing and doing something like this, you still have to go to the bathroom. You know, I mean, what do you do when you're out in the woods and you have to go to the bathroom, right? Well, I had a patient come in who almost died from black mold poisoning. I don't know what that's like, but that doesn't sound very fun. And nobody could figure it out. I mean, that would be a hard one to understand. So she was just getting really, really sick, going to the ER with these like, you know, hypertensive emergencies, and her body was really malfunctioning, and she could no longer function and work. She was in a really challenging place. They figured out that her house was full of black mold. That was 3 years ago. She got out of there, and, you know, again, she got better. She's not in the ER all the time, but she's not feeling like herself. So she came in to see me in the office, and we talked about that. And her cholesterol was 379. She's a petite, 49-year-old female. She's not overweight, doesn't have metabolic syndrome, but her cholesterol is almost 400. Knowing what you know tonight, what I've already shared with you, does that make sense? An infection that almost killed her, 3 years later, her cholesterol is still really, really high. So her body's still trying to clear that stuff. So the ER room kept her from dying. They do that very well. But we don't then follow through and say, now that you're not dying, here's how you get really a whole lot better. And that's really the type of work that natural medicine, chiropractors, people like me work on, right? So we put her on a 10-day gut program that's very intense. We use you know, herbal antibiotics, essential oils, berberine, really high-quality probiotics, super pure, clean, strong stuff, digestive enzymes, and she agreed to do coffee enemas. I said, look, with what you've been through, you got to get as much cleansing as you can. I was even afraid to give her supplements that had like B vitamins in them, because I was like, I don't even know what kind of bacteria or fungus is going to eat those B vitamins before you do. So one pearl tonight is that if somebody you know takes a good vitamin that you know that like is good for energy or helps detox, and they have this weird side effect reaction to a vitamin, it's probably not their own body that ate it. It's probably something else in their gut that ate the vitamin first. And then whatever that something in their gut did with that fertilizer is making them sick. I see that all the time. So you have to treat the infection in the gut before you can benefit from food. In fact, I meet people who have a perfect diet and they're still not doing well because they're feeding the infection. So you got to clear the gut first, and then you can move forward with other stuff. With her, interesting story, she agreed to do the program, 10 days, and then we carried it on at a lower intensity for another 4 weeks. And she did the coffee enemas every day. And for the first 2 weeks, she would put black coffee in, and then when she would relieve herself, white coffee came out. Okay? Never heard of this before. It's never happened again. We've had other stuff happen like this. But so she was cleansing yeast and fungus out of her body so fast with this program that doing the coffee enemas just kept dumping it out. But that's gross. I know, it's gross. For 2 weeks, black coffee went in, white stuff came out. Okay? That's a cleansing of candida and fungus from the tube that's supposed to feed her. So if this is living on the tube between her food and the inside of her body, and she eats B vitamins and kale and you know, salmon, the fungus eats it first. And whatever the fungus doesn't eat, she gets a little bit of. And whatever the fungus poops out, whatever chemicals the fungus makes with that fertilizer, then she's going to get. And this is what caused a lot of anxiety and crazy symptoms and a lot of messes with people. What goes on in your gut just messes with your brain because of that phenomenon. So she did a lot better once we got that off of her. The natural herbs and extracts killed all that stuff. It killed the yeast. It just removed it from the wall. And doing the enemas flushed it downstream and got it out of her body. Because that's a lot to try to get rid of all at once. And so these are her lab tests. So I was wrong. Her cholesterol was 343. Her triglycerides were 452. You think that she was drinking a 2-liter of soda every day. She was not. She had a good diet. Clean water, maybe some tea, a little coffee, vegetables, meat, nuts and seeds. That's in 30 days. Her cholesterol went from 343 to 250. Her triglycerides went from 452 to 229. Her HDL went from 124 to 71. So there's no, again, I've mentioned tonight that HDL is important, right? And I said that 50 to 60 is a sweet spot, 70 is okay, but 124, what's going on? Why is her liver producing all this stuff? Because she had a big gut problem that was giving her a little bit of an infection all the time, and her body's trying to clear it out. And you can see her liver enzymes, AST and ALT, dropped. So, no drugs, food, supplements, the right kind, the right dose, and a program, and it's a good case study. So let's fix this problem for everybody, right? Let's fix cholesterol. So I already mentioned we have the gut problem. So if you've been on a lot of antibiotics, if you've had chronic antibiotic exposure, if you've had bloating and gas and discomfort, chronic constipation or diarrhea, there's a gut problem that needs to be addressed. And doing that first yields much better results down the road. It's all about sequencing. I mean, if you're working on your car and you're doing a repair job, you have to do everything in order, otherwise you cannot make it happen. Or you could break something and actually make it a lot worse. I've done it, right? So your health is no different, man. You just have to sequence things correctly. Gut goes first. If the gut's not working right, you can't buy kale, cook it with coconut oil, season it to perfection, eat it, and get it inside your body very well. I mean, you're better off doing that than eating Twinkies. But if you really want to maximize your health, you've got to work on the gut. I'm not saying everybody has to eat meat. I have a wonderful person in my practice who is a vegan philosophically, and she's able to do that in a healthy way. So there are lots of different diets. But I'll say for people who don't want to spend all the time and energy and effort to do that kind of a lifestyle, a modified paleo diet is probably what works best for most people. Clean, healthy, organic meat, lots of green vegetables, lots of dense vegetables, squashes, roots, cruciferous, healthy fats, animal fats, guys. Organic butter, avocado, well, that's not an animal fat, but omega-3s, really, really important stuff for your brain. Small, frequent meals, my goodness. People who do not eat frequently and have low blood sugar are the people who are suffering it's like the zone of misery, we call it, okay? Someone with high blood sugar can go 20 years before they feel bad or show a symptom. The person with low blood sugar feels it the first time it happens and every subsequent time. And the problem with having low blood sugar, so signs of low blood sugar would be afternoon headache, jittery, getting moody if you don't eat, getting angry when you don't eat, shaking, extremely tired, and then you sit down and eat a plate of food like your friends are sitting and you're like, what's wrong with you? Do you ever, does anybody ever feed you? When you see people just consume a ton of calories all at once, they're on the hypoglycemic roller coaster. It's just, you got to get them off. Small frequent meals is the main way to do it, because every single time your blood sugar drops, your body shuts off digestion. Because you're asking it to do this. You're asking it to say, with limited resources, what's the most important thing right now? Well, the most important thing is that you keep breathing. So it's going to keep your brain turned on, but not the really smart part of your brain, just the basic life support stuff. But it's not going to help you digest your food. So when you skip a meal and you eat, let's say someone skips breakfast, eats a protein bar for lunch because they're too busy, and they sit down to dinner. What happens is their blood sugar's been dropping all throughout the day, they've been running on adrenaline, maybe pounding some coffee because, you know, it helps raise adrenaline too. When they sit down to that next meal at dinner, it's not going to be digested very well because the body has not invested a limited amount of energy into the gut. It's going to give it to the brain because that's what keeps us alive. I mean, if it has to choose between breathing and digesting, that's an easy one for your body to figure out. So, takes one to know one. I've been hypoglycemic like 20 years of my life probably. I didn't know it at the time because I didn't know all this stuff, but it's terrible on people. So don't let it happen to you or your kids or people around you. When your kids play sports, you'll see people getting injured all the time. It messes up your balance. It messes up your personality, your focus. You see people with potential, and then they never quite get to it. So it's in order to reach our potential, we have to take care of our digestion and our blood sugar. Small, frequent meals, guys. Small, frequent meals. I have people in my practice who eat more and lose weight all the time. It's really fun to watch. It's like, well, of course you're starving yourself. If you tell your body there's not enough food around, it'll hold on to every little ounce that it can because you're sending it a signal that it's you live in a sparse world. And I have more of an abundance philosophy. You know, one seed in that one cucumber is going to make like 600 plants, which, you know, after a couple generations, you have like 300,000 cucumbers, you know. Mother Nature sets it up that way. We just have to kind of help it. So there's plenty to go around. Just small, frequent meals, guys. These are some of the nutrients we use in no particular order. We use a lot of stomach acid because stomach acid is something that's expensive for your body to make. And as I've just described, lots of things make our body not optimally function. And when that happens, your stomach acid goes away. Another way to look at it is one of the top selling drugs in the world is an antacid, which means that most people are taking that medication because they don't have enough stomach acid. Stomach acid makes every other part of your digestive system work correctly. In order for your pancreas to release its juice, in order for the gallbladder to release bile, what leaves the stomach has to be acidic. It has to be. So, stomach acid's a big one, and all those things are useful in their own right. I'm just going to plug real quick the genetic testing. Maybe some of you have heard about 23andMe. You send your saliva in, and they tell you who you're related to and what part of the world you're from. But you also get this raw data. They basically put in this giant text file. It's like 25 megabytes of just literally like lines of numbers of what your genetic code is. And you can take that information and have other companies build reports on it, and they'll give you this nice like green, yellow, red, reports. And if you want to know more, it's a good thing to do. Sometimes people get that report and they call me and they're crying because it's like, it's all over. I've got all these reds and yellows. Well, look, it's just your genes. It's not your destiny. It's your tendency, and it's just insight into what your body's most likely to do when it's under stress. That's all I would say the genes show you. But it's good information. You get a report like this. This is my report. So you see all those reds. It means when it's red, it means you're either making way too much of something or you're slow at making it. Again, what does the body need that it cannot get? What does the body have too much of that it's trying to get rid of? That's all you have to figure out. If you figure that out, just get out of the way, the body will take care of itself. And, basically the close here is that I want to thank you for your time and attention. And, the purpose of me coming here tonight was to share with you about cholesterol. I hope that I've given you some new ways to look at it. And cholesterol is this fascinating study because it brings together stress, it brings together our immune system, it brings together healthy aging, and that was that was the purpose of tonight. But I want to invite each and every one of you who are interested in learning more about natural medicine and getting healthy and what these kind of ideas can mean to you to allow me to help you. Thank you so much for watching this video and sharing it with your friends and family. I personally believe, as I'm sure you do as well, that educating ourselves about what it truly means to be healthy is the only way we're going to change healthcare. I have created a website as a resource for you. To take advantage of this information, navigate to www.beyondmthfr.com and take a look around. In addition to blogs and articles I have written, you will find a tab on the menu labeled Protocols. It is a growing list of tools that I use in my office to help support my patients. You will find background information on common health conditions, you will find a detailed supplement protocol, and you will find dietary advice to support the body's natural healing process. You will also have access to order recommended supplements at a discounted rate and have them shipped to your front door. I'm giving you the tools that I use in practice every day to help you overcome health challenges and live a happier, healthier life. I have done my best to give you that information, and you will find it on these protocol pages. If you are looking for more help than simply what supplements should you take or what diet should you follow, I'm inviting you to come to Boise and see me. Let me and my team and my staff take care of you. We have patients coming from all over the country and all over the area on a regular basis, and there's room for you too. Now, if coming all this way to Boise is too big of a commitment, then please pick up the phone or email my office. We can work together from a distance.